everybody. Clayton Ross. It's a pleasure to be here today. I'm a second-year med student at MUSC in Charleston, South Carolina. And I also happen to be a burn survivor. So I'm super excited to share this research with y'all today. Disclosures. Dr. Schmidt, who is one of our co-authors, he is a member of the advisory board for the next-gen sequencing company that we used in this study. So, burn wound infections play a huge role in severe complications that arise in burn care, namely septic shock, graft loss, and then even death. So, despite the impact that microbes and infections have on burn wound recovery, we don't really understand the role that the microbiome plays. And a huge part of that is because the technology that we're using to assess the microbes in the burn are not effective enough. So historically, traditional wound cultures are kind of the baseline for how we assess the microbiome, but they have proven to be ineffective, they're pretty inaccurate, and they're very costly, and additionally, they're time consuming. So they're not routinely used in burn care any longer. So next-gen sequencing, on the other hand, could be a promising alternative. It has been used effectively in other areas of medicine, but it has never been applied in the field of burn care. And so first step to applying NGS is saying, is it inferior to wound culture, which is the standard of care for burn microbiome analysis? So to do this in our study, we had 80 adults undergoing burn care for an acute burn injury, and we took a wound swab as well as 2 adjacent tissue samples that were discarded, and then we compared them using next-generation sequencing as well as traditional wound culture. So thus far, our preliminary data includes 40 out of our 80 total samples. As you can see here, 25 of our samples showed correlation between the next-generation sequencing analysis and the traditional wound culture. On the other hand, we had 15 discrepancies. In 11 of those discrepant samples, NGS actually suggested superiority to the traditional culture. And then in 4 samples, next-gen sequencing was inferior to the culture. It is worth mentioning that the inferior samples, the 4 out of 40, or the 10%, is likely due to a technical error. So when you take the tissue samples and you send them for next-generation sequencing, if your tissue samples are very thick, the human DNA really overshadows the microbial DNA, and that results in false negatives for the NGS in particular. So, very exciting. Next-generation sequencing identified all of the pathogens and the commensals that we detected on traditional wound culture. In addition to that, it had a 3.3-fold increase in overall detection. So the majority of the additional microbes that were detected by next-generation sequencing were actually commensal species. These are the microbes that are on your body. They help you. They're just hanging out, having a good time, not doing anything wrong. And then the other aspect of the additional detection were atypical pathogens. Now, this is talking about pathogens that may not have entered the realm of clinical medicine yet, but in the future, they might emerge as an antibiotic-resistant pathogen or something of that nature. So in addition to this superior number of microbes that next-generation sequencing detected, it also suggests, our preliminary data suggests, that next-generation sequencing may offer earlier detection of known pathogens, and notably Pseudomonas, which is a very prolific colonizer of the burn wound. It's implemented in a lot of septic shock cases and also a lot of cases that result in the death of the patient. It was detected earlier on next-generation sequencing, which is pretty cool. And then lastly, next-generation sequencing, unlike traditional culture, offers insight into the microbial drug resistance profiles. And we don't know yet if that is clinically significant, but it certainly is something that is cool to look at and something that traditional wound culture does not offer us. So lastly, next-generation sequencing, hands down, is significantly cheaper than traditional wound culture. Furthermore, it takes significantly less time to receive those results. So when you compare the billable rate for next generation sequencing to traditional wound culture. And by billable rate, I'm talking about, what you'd be paying in the clinic when you're doing these analyses for your patients. Next generation sequencing is 5 times cheaper than the traditional wound cultures. And if you compare the discounted research rates that we were paying in our study, NGS is actually 10 times cheaper than traditional wound culture. So this is huge for research being done in the field as well as clinical applications. Means less costs for the clinician, and that translates to less costs for the patient. So not only was the next generation sequencing technology cheaper, it was also very much quicker. We had tissue bacterial cultures come in about twice the time of the NGS samples. So that's 2 days versus 4 days. And then for our next generation sequencing fungal detection, that came back over 3 weeks earlier than the traditional wound culture. Now, time is money in the case of burn wound infections and could mean saving lives. So in conclusion, we found that next generation sequencing technology was non-inferior 90% of the time. Additionally, next generation sequencing is far less costly, and you get the results back far sooner. And so that's huge for burn care. I'd like to thank MUSC, I'd like to thank the Department of Surgery for their support. I'd like to thank the foundational institutional grants that make the research possible. I'd definitely like to thank my co-authors, collaborators, and then most importantly, my mentor, Dr. O, for his assistance in the project. And thank you all for listening. I'll take questions if you have any. Yes. I would say the biggest barrier would be continuing to put out research that shows this, that it's not inferior and in fact looks superior to what we use now, which is traditional wound culture. And again, as I touched on, traditional wound cultures aren't necessarily even used that much because they're so hit or miss in terms of analyzing the microbiome. And being that the next generation sequencing technology has been demonstrated as effective in other areas of medicine, I think that if we can make this technology accessible to clinicians, like in the hospital, I think that's really the biggest step in promoting the use of it. And then additionally, just like putting out more research on the subject. So that's what's super exciting about the future direction for this study is like we've shown here that it's non-inferior. Now we can go about using it to apply to patients. And really what is fascinating about the NGS technology is because it's so much more efficient in terms of cost and time, it allows you to do a lot more analysis on a lot more patients. Historically, the biggest constraint of burn microbiome analysis is really the cost and the time that it takes to get traditional sample cultures back. It only allows you to have a sample size of 10, 20 patients. But with the efficiency of NGS, we can bump that sample size up to hundreds of patients. And then we can actually sit down with the data from the microbiome and say, okay, how is the microbiome changing over time? Are pathogens in the wound closer to the date of injury changing compared to later on in the treatment of this burn care? And then more importantly, and the most fascinating thing that I think is we can kind of begin to ask questions like, when you have Pseudomonas or like a known pathogen that's taking over the wound microbiome, it's going from the biofilm into the wound, penetrating the tissue, is that because Pseudomonas is actually out-competing all of your commensal microbes? Or, this would be very interesting, is it that the treatments that we're using in burn care, washing people with bleach, dumping antibiotics into their bloodstream, is that actually having a negative effect, killing off all of your commensal species, and then opening the door for these pathogens like Pseudomonas to come in and cause havoc in your body? I don't know for sure. I would imagine that most of the products are privatized, but like a lot of the products that you use in the hospital, you're paying someone to make it. And as long as you can kind of have a mutually beneficial relationship, I think it opens the door for, like I said, a lot of other things that we can do with the technology. So there is no standard of care for the next gen sequencing in burn care as it stands. And so that's really what we're trying to do. If we can show that it's non-inferior, then we can start a clinical trial where we apply NGS and use that to analyze the microbiome in patients. And again, as I said, if we can, like this data suggests, detect pathogens that are killing people earlier in the treatment or the course of their treatment, that will save lives. So it's really fascinating. Mhm. So in our study, all of the preliminary data, so we had the 25 samples that correlated. So when that meant they correlated, it was either a positive next-gen sequencing detection with a positive culture or negative and a negative. And on all of the samples where they both had a positive correlation, NGS detected all of the species that traditional wound culture detected, in addition to like a 3.3-fold increase. So they detected all the same and more. Anybody else? All right. Thank y'all.